So it is fair to say that events such as Change Healthcare and CrowdStrike will impact Cyber Conversations 25, but in two different ways. Number one, Change Healthcare definitely is creating regulations coming. Like, we know that Congress is working on some regulatory changes into the healthcare space. So we know change is definitely coming in 2025 in some form or fashion. Now, again, change of administration, does it get delayed? Doesn't it get delayed? We'll see. But there has been work on kind of a gut reaction to Change Healthcare and changing some of the requirements. CrowdStrike is actually having the opposite effect, which I found a little surprising at first, because not a lot of people have punished them for the outage. What do I mean by that? They have not had significant churn. And I know from a number of CISOs that I talk to, they're not going to change out their CrowdStrike product. They love it. Even though there's an outage, they survived that outage. I think they think it's more work to change it out than to leave it in place. And so I'm not sure CrowdStrike changes much of the conversation in 2025. So again, I see these as two different kind of things. CrowdStrike was an availability attack. It wasn't a traditional adversarial based attack. And in that case, they're not being punished for that outage because it was an availability attack. Where Change Healthcare, being a confidentiality integrity attack, a loss of data, also had an availability impact. But because so much data was lost as part of that attack, there's a different reaction to that versus CrowdStrike, which was just availability.